Less meat, more veggies. The USDA's new nutrition guidelines are out, and they take aim at salt and fat to battle the obesity epidemic. This morning, Gundersen Lutheran registered dietitian Jennifer Wood is here to explain how those changes will affect your dinner table. Good morning, Jennifer. Thanks for getting up with us.
Good morning, Amy.
Well, let's start with the USDA's recommendation to eat more plant-based foods. By that, we mean fruits and veggies. No, do they want us to all become more like vegetarians?
Well, I don't think they're saying that we need to become vegetarians, but they did take a look at us as Americans, as a nation, and decided that most of us are overweight or obese, and most of us are deficient in a lot of key nutrients. So in order to combat that, we need to eat more fruits and vegetables. We also need to have more low-fat dairy products in our diet, and we also need to include seafood that has essential fatty acids in it.
Okay. I also read some of the changes call for reducing the intake of fat from 35% of our calories to just 5 to 15%. That sounds like it's going to be a pretty difficult change to make.
Some of the changes are going to be difficult, and the interesting thing is we really haven't met the guidelines from 2005, and yet we're already changing them and making them stricter for 2010. But the truth is we do have too much fat, too much energy-dense foods, and not enough nutrient-dense foods in our diet.
Okay, salt. Huge changes here. The new guideline calls for Americans to reduce the amount of salt in their diet by 1/3. Do you think folks really have a good handle of how much salt is in their meals, in both those that they prepare at home and those out in restaurants?
Well, I don't think that we really do understand how much salt that we eat. And in fact, I was kind of surprised when I looked up the statistics yesterday that Americans eat between 3,000 and 8,000 milligrams of sodium a day. And the 2005 guidelines actually said we should only be eating 2,300 milligrams a day. And those that are at highest risk with heart disease, diabetes, and obesity should only have 1,500 milligrams. Well, now they've changed the recommendations because they said 70% of Americans are overweight, have heart disease or diabetes. So as a general recommendation, we should try to get our sodium intake down to 1,500 milligrams. And we should also increase our potassium too.
So basically we're all at risk for those diseases. One thing that really got my attention is I read that the new guidelines recommend against taking a multivitamin. Why is that?
Well, I shook my head a little bit on that one too. If you read it, it says for most healthy Americans, a multivitamin doesn't confer any additional health benefits, but you have to remember that they're saying 70% of us are also overweight and undernourished. So as a general rule, if you're eating a healthy, really good diet, you don't need a multiple vitamin, but there are some groups that probably do still need a multiple vitamin. But a multivitamin doesn't take the place of a good diet. There's so much more in a good plant-based diet than you can get in a multiple vitamin.
So that's the push, to eat it rather than swallow a pill.
That's right. A multivitamin can't replace a good, healthy diet.
Okay. Now, these are just recommendations, so we know that food pyramid is out there. Will that change here, or, will the public have a chance to weigh in? How does this all work?
Well, I'm not sure if the food guide pyramid is actually going to change. They made some major changes on that back in 2005. There may be a few changes, but overall what the Dietary Guideline Advisory Committee is saying is we need to eat more like the Mediterranean diet that's high in fruits and vegetables, or the DASH diet, which is also real high in fruits and vegetables, in order to be healthier as a nation. And they're trying to get that message out that it really does start with our dinner plate.
So basically they're just recommendations. It's up to us at home to make the actual changes.
That's right. We have to make the changes. We have to want to make the changes to be healthier.
All right. It's always tough, but we'll work at it. Jennifer, thank you so much for joining us this morning and kind of explaining all these new recommendations.
You're welcome. Thank you for having me.
All right. Salt. It's amazing how much salt is in the food that we eat.